Hello, and welcome to our case presentation on hepatitis A in fresh and frozen berries. Today we have our presenters, Michelle Danieluk and Taylor O'Bannon. Both of them are from the University of Florida. Taylor is a state specialized agent, and Michelle Danieluk is a professor of food microbiology and safety. So in this presentation, any opinions, findings, conclusions, or recommendations expressed are those of the presenters and do not necessarily reflect the views of the USDA Department of Agriculture. So welcome, Taylor, and welcome, Michelle.
Thanks, Ashley. As she said, we are going to be covering hepatitis A cases in fresh and frozen berries. So just covering a few of these outbreaks that have been implicated in fresh blackberries as well as fresh and frozen strawberries. The first one happened in 2019. Fresh blackberries were linked to two Midwestern grocery store chains, and 20 outbreak-associated cases from hepatitis A were reported. These were reported in 7 states. Including Indiana, Michigan, Minnesota, Missouri, Nebraska, Pennsylvania, and Wisconsin. 11 people were hospitalized and no deaths were reported. So as we take a little bit closer look at this outbreak, we can see that 95% of people sickened by the outbreak reported eating fresh blackberries, which is a significant amount of people who reported eating those blackberries that were implicated in the outbreak. Of 17 cases with known fresh blackberry purchase locations, 94% had purchased those blackberries from that grocery store, or the 2 grocery stores that were involved. And FDA completed its traceback investigation. However, they did not find a single common source of the blackberries. So in that one, they were not able to trace it back completely to the farm or the facility where the contamination source might have happened. The next one is frozen strawberries. This happened in 2016. They came from Egypt, were imported from Egypt, and they were sold in a popular smoothie cafe in 9 states. This was an especially large outbreak because 143 cases were reported, with 129 of those cases being directly from eating a smoothie. Now, 56 people were hospitalized, and again, no deaths were reported, but we can see a significant amount of people were sickened here in like the Northeast region, and then also in the Western California and Oregon. The next outbreak is going to be in fresh strawberries in 2022. This was from Baja California, Mexico. Fresh organic strawberries sickened 19 people in 4 states, including Arizona, California, Minnesota, North Dakota. 13 people were hospitalized as a result of this outbreak, and these illnesses started on dates ranging from March 28th, 2022 to May 6th of 2022. So almost like a 3-month span of this outbreak going on. 69% of people reported eating the fresh organic strawberries from this region. And then finally, the one that's most familiar to us probably and has been in the news most recently is a frozen strawberry outbreak here in 2023, again from Baja California, Mexico. These were frozen organic strawberries, which likely sickened 5 people from Washington. There were 2 hospitalizations reported, and the outbreak investigation is ongoing. So they're unsure of the exact source of this outbreak. So as we move into looking at hepatitis A a little closer, it's important to think about the symptoms of hepatitis A and how hepatitis A is transferred. So it is a hardy virus. It can survive being frozen for periods of time, and so that is why we typically see it associated with frozen berries. And it's spread through employees or workers through the fecal oral route. Symptoms of hepatitis A usually appear 2 to 7 weeks after exposure, making traceback very difficult at times. And there are no specific treatments, only supportive care. So, Michelle, as we're thinking about hepatitis A, what are the symptoms? What kind of things would you tell people in terms of identification of this virus?
Yeah, so I think, Taylor, unlike a lot of the other case studies we've done, right, hepatitis A is one where we know it's spread through the fecal oral route and its only source is humans. So in this case, if we see an outbreak of hepatitis A, we know that that means there's human feces involved. So we know that means there's a food handler somewhere along the chain from in the field through to consumption point that would have been the source. And so I think, unlike a lot of the other bacterial pathogens we talked about, we really need to control this in humans. And so I think that brings up the question you asked me, right? What are the sources in humans, or what kind of symptoms can we look like in human? And so hepatitis A, as is shown in the picture on the left there, is a virus that primarily attacks the liver. So if you don't know what that little funny lobe is in the middle, that's the liver being attacked by those hepatitis A viruses. And then all around it, we see the different sorts of symptoms of jaundice. So some of the main ones that we see, all the different symptoms of hepatitis A. And one of the main ones we see, and one of the ones we talk about a lot when you're training your employees and looking at your employees, is jaundice, right? So that's yellowing of the skin, yellowing of the eyes. And so jaundice is a really common symptom of hepatitis A. Nausea and vomiting can have. Dark urine can also occur, although I don't know exactly how you'd measure that in your employees, unless you're well, I don't even want to think about how you might be measuring that on your employees, but needless to say, I think a lot of us wouldn't see that for someone else. But jaundice, we could see, you can see very often. It also leads to some pain in the right side of the abdomen, weakness, fatigue, joint pain, and a reduced appetite. Taylor has lifted on there, there's no specific treatments, only supportive care, but there are vaccines that are available for hepatitis A, so you can vaccinate individual could be vaccinated such that they would never actually become infected in the first place with it.
Yeah, so we've touched on the sources of contamination, but just to reiterate, this really is linked back to your workers. We generally see issues with poor hygiene or improper hand washing as a main source of the way that this virus is transferred. And then, of course, people working while they're ill. So you can have human to human transfer of this, but typically it's going to be from that fecal oral route where someone doesn't wash their hands correctly. They're touching the same surfaces and interacting with fellow employees, as well as food contact surfaces and things like that, directly touching the fruit. And that is how we get the source of contamination. So while we're on the subject of how things are contaminated and hepatitis A, we really wanted to jump into kind of the lessons that we've learned from these outbreaks. One thing that is super important is that you know the symptoms, that your workers know the symptoms of hepatitis A, and they are able to report out on that. The symptoms appear within 28 days of exposure, which can make trace back really, really hard to know when they were infected. And then, of course, proper hand washing and exclusion of sick workers is imperative. This can be sort of difficult depending on, what kind of communication pathways you have with your workers, making sure that they are comfortable reporting those illnesses to you. And then, of course, being able to incentivize that so that hopefully they have the support as they will have to miss work likely. And then, of course, Michelle touched on the prevention. Vaccination is one of the easiest ways to prevent diseases from becoming communicable. And hepatitis A is one that is super effective in preventing this disease. So as we jump into what growers can learn and do, really it goes back to your workers, right? Reinforcing those worker training programs, making sure that they understand the importance of proper hand washing, not just going through the motions, but making sure that we're actively creating that friction, removing that organic matter as well as any pathogens that are on their hands. General hygiene, just keeping everything clean, our clothes clean, our ourselves clean, and then of course knowing when they're ill, how to report those symptoms. So we see a lot in industry. Growers will use signage, and this is a really great way to remind our workers of the symptoms of foodborne illness. And then of course, we always want to let them know how to report their illness. So who is the person that they talk to if they are feeling ill, experiencing any of those symptoms. Another one is keeping restrooms and hand washing facilities fully stocked and maintained. We want to incentivize our workers to use these restrooms and these facilities properly. We want to empower them to wash their hands correctly by having the proper soap and hand washing facilities fully stocked. And then, of course, share resources of healthcare options like vaccination. So many times our local health department will offer these vaccinations free of charge or very low cost. And so it's always a great opportunity to work with your local healthcare facility to encourage vaccinations.
Yeah, Taylor, and I want to say one more thing growers can do or can think about or learn has to do with those frozen berries, right? I mean, I think frozen berries are so easy, right? And especially if you're making a smoothie, it's so easy to just take and throw those frozen berries into it. But I think the hepatitis A outbreaks you talked about and some of the ones that we've even seen happening in other places in the world are linked back to these frozen vegetables, or sorry, frozen, Ashley cut that out, linked back to these frozen strawberries or frozen berries with hepatitis A. And so I think too, remember, if you are at risk for hepatitis A, then cook your berries, your frozen berries before you feed them to yourself or to your kids, because those berries are raw. They haven't been processed in any way that's going to reduce hepatitis A on them. Awesome.
All right, so just a quick look at our sources. Of course, CDC always reports on all of the outbreaks that are going on, and that is where you can find the most up-to-date information, as well as the New York Department of Health. They have a great fact sheet on communicable diseases as well as hepatitis A. And with that, we will direct you, if you have any further questions, to reach out to us at our emails at taylorlangford@ufl.edu or mddaniluk@ufl.edu.
Thanks, Taylor.
Thanks, Taylor.
Thank you.